Welcome back to Insight. We're at Indiana Physical Therapy, and again, I'm going to be the dumb guy today here on Insight, as I guess most days, but especially today. Tara, explain to me what the topic is, because I don't even know these words.
Okay. Well, today we're talking about edema, lymphedema, and vascular insufficiency.
Which means what?
Which means what? Edema is basically kind of just generalized swelling. It can be acute or it can be chronic and ongoing. It's more so a lot of times people see it in the joint, or it's that puffiness, that liquid, that fluid that kind of builds up. Vascular insufficiency has a tendency, it deals more with the circulatory system, and then lymphedema deals more with your lymph system.
Okay, and either way, obviously it's not good. Is it painful? Thankfully, I haven't ever suffered from it.
If it's more the acute of just kind of generalized edema, it can be if it's related to an injury. That soreness, that stiffness, that ache that comes with it. Vascular insufficiency can be as well. A lot of times people complain of a tenderness and a swollen, pressured feeling, but they usually have a lot of discomfort and pain with that. Whereas lymphedema, they don't really describe acute pain or sharp pain. It's more tight pressure. My leg feels heavy, my arm is heavy.
Mm-hmm. And so that comes from like those systems, the lymph system, the circulatory system kind of leaking, or what's that puffiness come from?
It can be. In the case of just general edema, where it's the acute, it's more of your body's response to trying to heal itself or let you know there's something wrong. In the vascular insufficiency, a lot of times those blood vessels, they get dilated and extend out so that those valves that are in there can't seal real well. And when that gapping occurs, you get more fluid into the area than it can get back out. So there's it becomes overwhelmed, and so we're trying to help get that back out. When it comes to the lymphedema, it's typically because that lymph system, they don't have valves in them. They're just having a hard time getting fluid moving around.
And that's your job then as a physical therapist. You can work on the inside and make these things kind of help heal themselves quicker?
Yeah, in most instances when there's the acute edema, you can usually cure that and kind of get it to go back down, because once that inflammation starts calming down, it gets back on track. On the things more like the venous insufficiency and with the lymphedema, there's no quote-unquote cure for it, but there's a lot of things you can do to manage it, get it back down to where it's controlled, and where it's not interfering and affecting your life as much.
Now, in a case like this, I know that you guys have direct access. Somebody could come to you first. In these cases, is that typical, or typically does somebody come to you through a physician?
I would say I probably end up with a 50-50 split. A lot of the insurances allow the direct access, so we can get those people in a little bit sooner. And then some people are coming straight in from their specialists or from their physicians, knowing that there's issues and problems already. But either way, we're always communicating with those physicians to kind of keep everybody on the loop and let everybody know what's going on.
And your goal in treating this is to have what happen?
Is basically you want symmetry on both sides. You want to try to get the swelling down and get everything under control so that everything looks very similar, because there's a cosmetic aspect to it as well, but decrease infection risk, mobility, everything like that as well.
Okay, I'm just kind of amazed that you can do treatment here, physical therapy for like an internal problem that just, I don't know why that seems funny to me or odd. It's not, it's not a muscular spine or something like that.
It is a little different than normal physical therapy. We take components and pieces that we use in physical therapy, but at the same time we use a lot of our more manual techniques as well. So it's a little more one-on-one treatment than setting them up with exercise and kind of monitoring their technique and things that way. It's a little bit different.
Yeah. Well, again, if anybody knows how to do it, it's Indiana Physical Therapy with dozens of locations now around Fort Wayne. If you want to learn more, you can go to their webpage, indianapt.com. We'll be right back on Insight.